Hi, I'm Marianne Opes. I'm the complex abdomen specialist at Regents Hospital, a level 1 trauma center here in St. Paul, Minnesota. And today I want to talk to you about using negative pressure wound therapy and convex barrier rings to isolate a fistula or stoma that has a wound near it. So here is our cute little fistula right here on the side of his wound. So he's got wound over here, and then intact skin from 6 o'clock to 12 o'clock. And then he had these big deep creases on either side and up here. And we tried so many different pouching systems for him, but he would leak, and he was actually still working, and so this was really hard for him. And so my buddy and myself decided to try negative pressure wound therapy together. And we needed something very flush because it was, as you can tell, the wound is all filled in, so we didn't need anything with depth. So what we did was we used a convex barrier ring, oval, and negative pressure. So we draped his entire intact skin all the way around with clear drape. And you can see it way out here to the edges. And then here's where his wound was. So then we actually picture framed the wound with clear drape and put them into the negative pressure system. What we did realize after we had placed this several times is that we added a little bit extra foam over here so we could move this track pad a little bit further from the pouching system, which helped to not provide any leaks. So the first thing we would do for this patient, remember he had skin on one side, a wound on the other. Obviously this is all skin as well. And then the fistula kind of in the middle, right next to the skin edge. So first thing, as my dear friend Dot Weir always says, is clean the patient first. Clean not only the wound itself, but all the area around the wound. So I really liking the Vashe gel to do some cleaning work on these types of patients. So I will put the Vashe gel all over and let it sit for a couple minutes, and then go back and use Vashe and wash it all up and allow it to dry completely. Obviously shaving if you need to, if your patient is hairy. The next thing that we'll use is the Cavilon skin protectant. How it works is you snap the top, and then I usually put it on the back of my glove until I make sure the fluid has come out. And then you want to put it all the way around the fistula, all the way around the wound, and then go wide. And then I also will go over the wound itself. And this is approved for over the wound itself, and it actually has some hemostasis properties. So if your wound is a little oozy, this will help quite a bit. Again, allow that to dry. The next thing I'm going to do is protect that intact skin. So I'm going to use my favorite 7806 barrier ring right here that I cut a piece into it. So I'm going to take this little piece and I'm going to put it right around the fistula, not too close to the fistula, because we all know that the bowel sweats, right? And if you get it too close, you'll get some leakage. So first I would do that, and then I pre-cut all of my pieces so that I'm fast when I'm putting this together, because we all know that fistulas like to explode during application of dressings. And so I try to keep everything ready to go so I can place it. So I pre-cut this, and I'm going to land this right on top of that barrier ring. See right there? I'm going to land that right on top of it. The next thing I'm going to do is to cut my foam, and I would have pre-cut it. So then you're going to take your barrier ring and you're going to cut the foam so that you can see the barrier ring through the foam. So you can see the edge of the barrier ring through the foam. That's super important to get a seal at the base. You can use these barrier rings this way, or you could put them this way, as long as there's enough room for the barrier ring to touch the skin to make that seal. The other thing that we've done before is we'll put one barrier ring on top and one on the bottom, and then sandwich it together. That works very nice as well. For our patient, we just used one, so I'm going to just use one today. So once you have everything all trimmed, and you can see we have extra foam here because we're going to land it out here on the edge of that little hump that he had. I'm going to peel the top of my barrier ring off and then put it into place. And then I'm going to peel the bottom one off. Put it into position around the fistula and on the wound. And then I'm going to take my pre-cut negative pressure drape and put it onto the edge of the berry ring. This is a very important step. You have to land it on the edge so that you get the seal. And then the other one needs to overlap the first one. So I'm overlapping the first drape that I applied. And then we're going to cut a hole for our track pad. Keeping the tail of the track pad going away from the pouching system. Okay, at this point we're going to hook our negative pressure up to the pump. And we're going to encourage a seal. If you don't get one right away, you can always add some Stoma paste on the inside. Sorry, this is very noisy. Okay, so now we want to add our fistula pouch. And I like to have a pouch with the window because it really makes it a lot easier to get inside there and make sure you have a good seal. So I'm going to put the pouch on now. And really you want to be able to see that convex barrier ring inside of the pouch itself, because we're going to add a little piece of the 7806 barrier ring. There's no leaking between the pouch and the actual barrier ring. So you don't have to do this step. I just added this step because it just seems to make things like leak-proof, especially patients that are at home. I just worry so much about them. And then my favorite part of the whole thing, of course, is powder. So you're going to powder it up good so that the lid doesn't stick to this sticky ring that I just put on the top, right? So I powder it until I can't feel anything sticky all the way around. And then you're going to close the pouch lid. And then don't forget to plug the end. Your patient will be very angry with you. And then once you get here, there should be no suction on the pouch. And that's negative pressure wound therapy with convex barrier rings. If you need any help, you can always reach me through the complexwounds.com website, and that goes right into my email, and I'm always glad to talk to anybody about fistula stuff. So have a good Fistula Fun Friday.